Recently, I had a close family member get the diagnosis of mild cognitive impairment, the beginning stages of dementia. They were able to be seen by this program within a hospital that was specific for memory care assessment testing. And for the first time in years, I felt this little bit of hope that the healthcare system might be moving in a better direction when it comes to our loved ones with dementia and figuring out how to manage this growing population of people with dementia. So in today's video, that's what we're going to talk about. I'm going to talk about the reasons why it gave me such hope. And then I'm going to tell you 3 things to make sure you ask about when your loved one is having memory testing being done. Before we get into the video, my name is Tammy Provenzel. I'm a physical therapist and a life coach for caregivers. Our healthcare system is broken right now. There aren't enough resources or guidance for caregivers. So I started this channel to be a resource for caregivers, especially of their aging parent. It felt kind of strange to me as I was listening to a family member talk about the new diagnosis of dementia. But internally, I was just amazed that this doctor is actually doing some of the things that I think need to be done to best take care of our population of people with dementia. I happen to live in a part of the country where we have great medical facilities fairly close by. But individual doctors, individual primary care doctors, the doctors that work in facilities and kind of manage all the patients within the facility, from my perspective, seem to be really resistant to talking about anything that has to do with dementia. That includes determining that someone's not competent to make their own decisions, having the conversation about somebody driving still. So for my uncle, who was the first close family member that I was a caregiver for, he was 99 when I had to take his license away. I tried going through his doctors, going through the VA, going through the police station, and the RMV. No one was willing to step in and take that right away from them. And I understand that. It's such a fine line to walk. But it was a really difficult thing for me as a family member to have to take his license away. And in my case, it was really hard for me to be the person to do that. I tried to use things like the police say you can't drive anymore, or the VA says you can't drive anymore. And those were minimally effective, but not greatly effective. And in the big picture, it all worked out okay. But at this most recent appointment with another loved one, this doctor actually had the conversation with the patient. You need to stop driving. This is a hard conversation. And from what it sounds like, this doctor was amazing at communication. He said, I hate to break this to you, but you have to stop driving. Then he gave them the option of paying $400 or $500 to have their driving skills assessed and potentially keeping their license. So my feeling is offering that gives the person the feeling of a little bit of control. They can do something if they want to keep driving badly enough. But then he said, your significant other is going to come to all these appointments with you that we're going to set up for the future. I'm going to ask them every time if you've driven. If I find out that you have driven, I'm going to have to contact the RMV. And again, from what I understand, he did it in an unbelievably compassionate way. He made it really clear that this was not a comfortable conversation and he hated to be the one to do this. But my family member decided to stop driving. And this is someone who I never would have thought would have given up that easy on driving. So that alone gave me so much hope that there are some doctors out there that are willing to have these really hard conversations. The 3 things, though, that they really focused on, and I think is really important when we're looking for a diagnosis of dementia, is to rule out any other possible things that could be going on, any medical things that could be going on. So what this doctor did was to take labs, and so they were able to find out that there's some vitamin deficiencies. That's really good information because certain vitamins can affect our cognition. The second thing was to look at the medications that the person is taking now. Sometimes people are getting too many medications for one diagnosis, and that can have an effect on cognition. Or they're taking a medication for sleep. A lot of sleep medications can affect our cognition. And then the third thing that this doctor talked about were other diagnoses that could have an impact on cognition. So for example, diabetes is a big one because it has to do with blood flow. And if we're not getting good blood flow to the brain, then it affects how we think. Same thing with hypertension. If we have uncontrolled hypertension, we may be causing small mini strokes happening frequently, and that can affect our cognition. So today's video is just to share some hope that our healthcare system might be, or at least parts of our healthcare system, or at least certain people in our healthcare system, might be moving in the right direction. If you do have your loved one being tested for a cognitive impairment, remember those three things: other diagnoses that might be causing some symptoms, medications that might be causing some symptoms, and any vitamin deficiencies that might be causing some cognitive impairment. Thanks for watching today's video. Please like and share with anybody else who might find it helpful. Subscribe to this channel, and in the comments section below, add any other good questions to ask if you have a loved one that's going in for memory assessment.